Imagine this, a woman freezes her eggs at 25, she builds her career, travels the world, finds love late, and at 45 she gives birth to a perfectly healthy baby from the same eggs she froze 20 years ago. Sounds like a miracle, right? Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Today I'll show you it's not magic, it's powerful reproductive science. So we'll talk about what egg freezing really is. A woman is born with all the eggs she will ever have. No new eggs are made after birth. By age 30, fertility starts to dip. Age 35, egg quality drops faster. And age 40, chromosomal errors rise very sharply. Egg freezing allows us to pause the biological clock of the egg even though the woman continues to age naturally. Today, eggs are frozen using a technique called vitrification. It is an ultra-fast freezing method that prevents ice crystal damage and preserves the DNA of the egg safely. We are not freezing time, we are freezing potential. So the question is, do frozen eggs age inside the freezer? This is probably the most common question I get. Will the eggs age inside the freezer or wherever we are freezing it? The answer is powerful and simple. No, they do not age. Inside the liquid nitrogen, the temperature is minus 196 degrees centigrade and all biological activity completely stops. This means there is no DNA aging, no chromosome damage, no metabolic activity, and a 25-year-old egg used at 45 still behaves like a 25-year-old egg. This is not theory. Babies have already been born worldwide from eggs frozen for 10 years, 15 years, and even close to 20 years. They are perfectly normal, healthy children. So, talking about children, are these babies that are born from frozen eggs healthy? Let's talk science, not fear. Large international studies from USA, Europe, Australia have shown that babies born from frozen eggs have no increased risk of birth defects, no increase in genetic abnormalities, normal physical growth, normal intelligence and development. Frozen egg babies are not weaker babies, they are scientifically protected babies. In fact, many times they are genetically younger than babies conceived naturally at later ages. Yes, we are freezing the egg, but what it cannot freeze is what you should know. Now, this is the honest truth nobody advertises. Egg freezing freezes the egg's age, but it does not freeze uterine aging, blood pressure, diabetes risk, thyroid condition, heart health, immunity. So while your egg may be 25, your body at 45 still carries pregnancy like a 45-year-old body. That is why medical screening, cardiac evaluation, hormonal balance, uterine health are extremely important before using frozen eggs. So who should consider egg freezing? It's especially helpful for women who are thinking about delaying pregnancy, cancer patients before chemotherapy, women with low AMH, those that have family history of early menopause, and high career pressure lifestyles exposure. This is not a luxury anymore, it's become a reproductive insurance. Egg freezing does not guarantee a baby, but it guarantees a second chance. It gives women time without panic, choice without pressure, hope without regret. It does not fight nature, it works with nature using science. If you wish to know more, please feel free to contact us. Thank you.